they're so similar, and then we eat some of those organisms, and some of them live inside of us also. We have a lot of living organisms inside of us that dwell there permanently.
We are a world in and of our own. If we knew what was even on our tongue or under our fingernails or in our digestive tract, it would totally amaze us.
So basically, it's very interesting. I think that if we can learn how to correlate better and help other species also to become healthy, just like we want to be healthy, then we will be healthier, because if they transmit things to us and we don't get them sick anymore.
You are exactly right. What is good for humans, invariably we would expect would be good for animals. Invariably we would expect would be good for the environment in which we live.
And we're living.
Thus, One Health.
I know. And then we're living in a world that is modernized and it's full of technology and expansion as far as construction and exploitation of natural resources and equipment, industrial stuff that have a lot of benefits, but they also have a lot of things that can affect us if we're not doing things properly. And that's another issue which I would like you to tell me. How are you working with the environmental aspect of the groups that collaborate? Because we have the local Puerto Rican medical bar or medical college of doctors and surgeons has been very active in taking a voice concerning issues of things that are in the environment that are affecting the health of human beings and animals. And I would like to know if that's happening elsewhere in the United States, if people that are part of One Health are doing that as in a larger sense in the United States and in other countries that you might be collaborating with.
That is a very good question, and the best way I can answer that is with a very specific example. And I have trouble with the Spanish pronunciations, and maybe we can cover this later. But a physician talked to us yesterday about lead poisoning in children on the island of Puerto Rico.
Yes,
now,
sir.
what a beautiful One Health concept, because yes, lead is toxic to all mammals, including humans, and due to our technology, there are situations where it has entered our environment. So she talked about things, for example, that a number of decades ago, we outlawed the use of ethyl gasoline, which is an ethyl lead product, because that was putting lead in our environment. And since then, lead toxicity to the children has decreased substantially. And then we have eliminated the use of lead in paints, particularly exterior paints. And there are still sources of lead out there, and this physician was talking about how we identify those and how we would take and demonstrate the lead levels in these children and take measures to reduce their exposure to lead and help them developmentally on any lead exposures that had occurred. So,
is it Dr. Gredia Huerta you're talking about?
Yes.
Okay, because she had a conference yesterday about children and lead.
Yes.
And is there a problem in Puerto Rico? So I was thinking.
Yes, Grady. I could not think of that
Yeah.
name, but she is the physician that gave that. A very good example. And so even if you would want to look up her report, that was in our One Health
Seminars
session.
yesterday.
Yes. And,
we have a public hearing on the 12th, just this week, in Arecibo concerning a battery recycling plant that
That's
has
what
been
you're talking about, yes.
emitting lead into the community. They found out because the children were acting strange, and one of the teachers at the Head Start program asked to have them checked. And that's how they found out that their parents, who were working at this factory, were bringing the lead in the car and contaminating the family with it.
No, she did talk about those aspects. Now, so this doesn't destroy off regulatory or political in any way. I think the point that we make here is that in many situations, for example, a veterinarian may find a lead toxicosis in animals. And then we would say, okay, we treat that animal and then we forget about it. Well, no, where did the animal get the lead from?
The source.
Are children in that same environment being exposed to lead? And this is also true in infectious diseases. One of the speakers yesterday, Shane Chathamy, Dr. Shane Chathamy, was talking about infectious diseases. So he was talking about leptospirosis, I believe. It was not on Puerto Rico, but it was in Georgia, west of the Black Sea. And he showed where leptospirosis was occurring in animals on a distribution map. And then he showed where leptospirosis was occurring in humans on
Can
a
you tell us
distribution
what that
map.
is for people who do not know?
Oh, I'm sorry, yes. Leptospirosis is a bacterial infection, a serious bacterial infection, usually acquired by contaminated water. So an animal or a person would have exposure to contaminated water. There are carriers of that bacteria that go around and are shedding it all the time, usually in their urine. That contaminates our water and our soil, and then humans and other animals are exposed to it. So, and I'm sorry that I made...
No, that's fine.
But when you put those two maps together, they coincide 80%. So animals could be used as a bellwether, I think that's the right word, as an indicator of where we should possibly be looking for certain infectious exposures and an infectious risk to humans. Because there were areas on his map where humans were showing up with this disease, but animals weren't being reported. So what's going on there? We need to look at the animal community. Or more importantly, where animals were having fairly high exposure, but at this time, there was no reported human illness. So, wow, are they just being unrecognized? And maybe we need to concentrate in those areas with some preventive efforts to make sure that it does not move from the animals in that area to the humans or the other way.
I find it fascinating that you're actually doing this, because what usually happens is the doctors are so busy with their patients that they're just seeing the patients and they don't really have the time to report this unless it's something really drastic. It goes like they take care of the person and there's no coordination with that. And the veterinarians, most likely the ones that, the regular ones that just work every day with their animals, aren't doing it either. So that somebody now has started to study this, and I hope that eventually there will be a system where it would be easy for individual doctors and veterinarians to report things, you know, without being part of a study.
I love your questions. You really studied this intently, because Dr. Johnny Ruyan, did I pronounce that right?
Yes, Ruyan, but that's
okay.
good enough.
He spoke to us yesterday, and he was talking about this exact subject. He had PowerPoint after PowerPoint that covered the reportable diseases, and he was talking specifically about Puerto Rico. So yes, there is a reporting system for diseases of serious infectious diseases that affect humans. I don't know the exact numbers, but hundreds of them just for the island of Puerto Rico. And by comparing data from the animals on Puerto Rico and the humans on Puerto Rico, I am quite certain we would be able to make some connections and say, well, this is an area where we need to really emphasize education and prevention and be aware of cases for treatment. We were looking to the south, but here's this area to the north that would likewise require some attention.
I really, I've been following certain things on the island for a long time. I think that where we still have a little bit of a problem, and I don't know if that's only here locally or it's also happening in other places in the States, where the reporting, it's much easier for the diseases, but not for the contaminations.
Yes, that is more difficult.
There's not that many, until it explodes into a disaster, right, that we don't have enough prevention going on before it gets big.
That's maybe why I changed the subject to infection early on, because let's start where we can and get our hands on concepts and aspects of collaboration that we can see some immediate applications and benefits from it.
So that would be a place that, I mean, in our case here, the medical college has been very active, as I said before, in starting to get more involved in the environmental part of it, and they go to hearings and explain why they consider certain things are good or not good for us to have on the island, because it could lead to other things. And I think that's important because you usually find out when areas are declared toxic and it's already too late. And I don't want to. I know that, as you say, that it's not really that.
Yes, but it's
coordinated.
relevant. What I see you doing here is coming full circle.
Correct.
And that's why I think that this meeting intrigued me, and had enough interest at AVMA that they would send me down to represent that entity. This is an island, and so it has a very discrete boundaries and margins. When you hit the sea, you're at the end of Puerto Rico, and so you're correct. Things like infections and environmental contaminants, toxins in the environment, we think can be quantitated and localized and maybe addressed on a much more less complicated level here on Puerto Rico than, let's say, in the continental United States. So that's why I am very interested to see how this continues to develop on this island, and it could prove to be a model that could be used then on larger bodies of land.
We're contained in a specific area, but that also makes us a little bit more vulnerable
Oh,
because
certainly.
you don't have a lot of alternatives where to go and how to get away from things, you know.
Which might be why the interest or intensity of the One Health concern seems to be stronger and particularly more readily accepted by the physicians on this island than on the continental United States.
Right.
And I don't say that negatively. I say that very positively about the Puerto Rican physicians without any implications on the continental physicians. There is a growing awareness and concern there even.
Have you been working with veterinarians from other parts of the world in this effort, this collaborative effort already?
The AVMA has been a proponent of One Health ever since that report you mentioned, and it was formulated by a friend and mentor of mine, Dr. Roger Marr. And so I came onto the executive board in '06 as he was intently involved with that task force putting together that information. And I feel very fortunate to have had that exposure. And so then you're taking it from the United States globally. Yes, the Federation of Veterinarians in Europe, the Animal World Health Organization, OIE, even the visit that I made to China, all of those areas are showing interest in the One Health concept and realizing the scientific and medical validity of looking at things as an entire structure, an entire system, rather than pulling out individual components of it.
I remember when we had the H1N1 virus in 2010, I think it was, how we could see that map with the World Health Organization saying it's going to Mexico first is where it exploded. And I like their solution a lot. We can probably talk about that in a minute. Then it started coming into the United States. Then there were some people from the United States in Japan, and they could not leave because there was an outbreak there. And then we started hearing about other things like the avian virus that were, every time there were outbreaks, they were telling people, be careful here, be careful there, because boats come from a certain place with merchandise and animals can be there. So when things are in a critical level, we see in the news that they express that we are connected. But then after that is over, we don't see anything until the next crisis.
No, and maybe it's good we don't. We might be paralyzed by it if we did. But Dr. Geo Brundtland, I believe I have that name right, and that was in the notes that we had discussed. But he said that infectious organisms travel our globe as fast as money. And then, which, goes pretty fast. And then he said that our world is awash in a sea of microorganisms, meaning that yes, what occurs here in Puerto Rico cannot be isolated to Puerto Rico, nor can Puerto Rico isolate itself from infections that are occurring around the world, because certain infections just travel so easily, being carried in the human respiratory system or with our pets or with our livestock, that are being moved all around the world. And so that might be one factor that is driving this increased interest in One Health.
Well, here on the island we have what they call the sands from the Sahara. They come in once a year. They cross the Atlantic, and they're full of dust and other kind of allergenics, and they also have bacteria sometimes. And people get sick. I mean, they say it's a Sahara, powders that come. So anything, as you say, could go through, like the
I have no
Chernobyl.
awareness of that, but it is a very small globe.
It's like the Chernobyl thing that goes around the planet, the residue of the nuclear dust still goes around the planet after that explosion so many years ago. It's still there. So somebody that's on, like, and now we have the Japan Fujihama thing that's crossing over.
Yep.
So even if you're not even close to something nowadays, you can get it. You
so One Health makes absolute sense.
One Health is perfect. I mean, so maybe we should wrap it up right now for this interview, because I think that it's good that people know that this exists, and maybe people could look it up. I looked it up. It's called onehealthinitiative.com, and there's a lot of information there. I hope that maybe we'll have a One Health meeting here soon.
My impression is that this program here has applied some inertia to the One Health movement, and I don't see that not being followed up by other meetings and joint committees between the Puerto Rican Medical Association and the Puerto Rican Veterinary Medical Association. I see those two groups continuing to work together to find ways that they can collaborate, share information, communicate with each other, and have continued conferences like this where these items are discussed. And you can see the fine list of speakers that were brought in for this meeting, some top individuals.
Incredible people here.
And so this is not an end in itself. It's just the beginning.
Well, and I can tell you this, Puerto Rico is bilingual. So we can bring in Spanish-speaking organizations from all the countries that speak Spanish into the, like,
I agree.
past.
Between English and Spanish, we will cover
most of the planet. A big part of it.
Yes, a much larger slice of the planet. Yes.
So, Doctor, I really appreciate you were here with us. I was so enthusiastic when I heard you were here, because I had not seen the program for the day, and that's why I wanted to take advantage of your visit here on the island, and I hope it's the first of many to come, because I really believe that we are all connected, and I think that's going to be the solution when we all see how much we depend on each other, and the whole ecosystem, how much it depends on everything in it. Then we'll probably find a way to be able to live better and adapt all the new things so that they don't affect what we need to keep from the old stuff.
Exactly, and the way I would look at it, I really wasn't listed in the program, is why you didn't see me, because I hope I contribute some, but my main function here is not as a contributor. It will be more as a benefactor. So we hope to learn some things and see how things operate here on the island, and see what aspects of this meeting can be utilized and applied in other parts of the United States and other parts of the world.
So I'm glad for that, and I look forward for you to be sending us information, and I know the people that are here will be in touch and let us know in the future. So
the vast majority of your Puerto Rican veterinarians are members of the American Veterinary Association. So really, I wasn't here visiting with a foreign membership. Certainly the Puerto Rican Veterinary Medical Association is unique to your island. But like I said, many of those have dual membership also in the American Veterinary Medical Association. So they are our members also. And that is an important means of communication between the island and the continental United States, providing them the insights, the benefits, the collaborative opportunities that the AVMA would bring.
Well, thank you so much, and enjoy your stay here on the island.
Thank you. We will.
Bye-bye.